Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to make a better system for all of us by taking actions. We have a lot of topics to cover today, including updates on bone cancer. We have updates on nutrition, actually lack of nutrition, a whole host of subjects. But before we get to them, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, which is the text for today's video. If you go there, you can of course subscribe for free to the Healthcare Advocacy newsletter, but you'll also find all of the links I mentioned, all of the references to medical journals. We usually include links to the actual medical publications, the actions we have, everything is in here, together with links to the news stories where a lot of these things are originally published. So let's get started. First, bone cancer news. Bioactive glasses are a filling material which can bond to tissue and improve the strength of bones and teeth. Has been combined with gallium to create a potential treatment for bone cancer. This work was done at Aston University, and there's a link to their newsletter on it. Tests in the lab found that bioactive glasses doped with the metal have a 99% success rate of eliminating cancerous cells and can even regenerate diseased bone. Now, gallium is highly toxic, and the researchers found that the greedy cancer cells soak it up and then self-kill, which prevented the healthy cells from being effective. This is just outstanding. The research paper is called Multifunctional Gallium-Doped Bioactive Glasses, a targeted delivery for actinioplastic agents and tissue repair against osteosarcoma. It's a long title. Anyway, it was published in the journal Biomedical Materials, and there's a link to their publication there. Osteosarcoma is the most commonly occurring primary bone cancer, and despite the use of chemotherapy and surgery to remove tumors, the survival rates have not much improved since the 1970s. Survival rates are dramatically reduced for patients who have a recurrence, and primary bone cancer patients are much more susceptible to bone fractures, which you would sort of expect. Anyway, this is incredibly exciting good news, and hopefully they'll be developing treatments for people coming out of this. Let's talk about long COVID and disability. This was a really surprising study I found. Researchers from Kansas University Institute for Health and Disability Policy Studies at the KU Lifespan Institute and the Patient-Led Research Collaborative just published a study showing that more than 40% of individuals with pre-existing disabilities who tested positive for COVID-19 experienced long COVID. Now, it's defined as symptoms lasting 3 months or longer. This rate is more than twice the 18.9% of individuals who don't have disabilities and who contacted COVID. Now, research has long documented that individuals with disabilities face barriers to healthcare access and experience poorer health outcomes than non-disabled peers. However, many studies during the pandemic only asked about disabilities that were present at the time of the survey rather than when the individuals maybe had a disability prior to the start of the pandemic. The research team compared data from the 2022 National Survey on Health and Disability conducted by IHDPS to the Household Pulse Survey conducted by the Center for Disease Control and Prevention. Of course, those two data sets are in the newsletter. You can find them there. The disparity showed that better policy is needed to address health challenges for people with disabilities. It should never be twice as high. This is not an issue of the disability causing long COVID. This is much more likely that they are not getting the care they need when they have COVID, and so somehow it hangs on longer. Okay, let's talk about long work hours. It turns out, here's a big shocker, long work hours are actually harmful. Okay, big deep breath. The Government Accounting Office released today, this is September 11th, 2024, a report on the effects of very long work hours. The GAO found that working very long work hours, that's 55 plus hours a week, they claim modestly, but it actually significantly increases the risk of stroke and ischemic heart disease, that's coronary heart disease, relative to working standard full-time hours of about 40 hours a week. There is a chart that I include in the newsletter. You can see it there. What it shows is that the risk of stroke is up by 35% if you work extra long hours, and the risk of dying of coronary heart disease increases by 17%. I know you probably don't need reading material to keep you awake at night, but I have a link to the report in the newsletter, and you can read it, and it'll probably keep you awake or keep you out of overtime. Anyway, I do recall, this is on a personal note, one program I worked when I was at Hughes Aircraft. We were working to get the deliverable, this was a system we were building for a customer, out the door, and it was a really tight timeline. And we were a small team, and everyone worked 12 to 16 hours a day for 7 days a week for about a month. And we finished, and we got it delivered on time, and it was a big hit. Most of us were in our 30s, and I think pretty much all of us were sick as soon as that thing left the plant. I'm just saying. So working extra long hours is just not good for you. Let's talk about food insecurity. This is a particularly unhappy topic. Food insecurity is broadly defined as lacking regular access to enough safe and nutritious food for normal growth and development for an active, healthy life. It affects about 1 in 7 children in the U.S. The gap in food access exposes children to unique and severe risks that jeopardize growth, cognitive and behavioral development, while increasing susceptibility to chronic illness like asthma, anemia, developmental delays, and mental health disorders. There's a link to where this news came from. It was MedPage Today. The U.S. Department of Agriculture actually operates 16 programs, I had no idea it was that many, to help provide food to people who need it. 1 in 4 Americans make use of those programs every year. I have a link in the newsletter to the USDA site where they list all 16 programs, and if need be, go there and you can apply for them. The causes of child poverty cannot be separated from those of adult poverty. Expenses associated with raising children are one of the main reasons that many families fall into poverty. I'll go off script here and tell you it's that, together with stagnant or wages that do not keep up, not with inflation, but with the inflation applied to housing, because the housing rate has gone sky high faster than any other cost in America. Okay, so job losses, pay cuts, transition from a 2-parent household to a single-parent household, maybe a family member picking up a disability along the way. All these things increase the risk of poverty. Factors that make it difficult for people to meet their basic needs mean that their children also grow up with economic instability and deprivation. The U.S. is one of a very few industrial countries that do not have a comprehensive social safety net to fully shield these children from the emotional, physical, neurological, and generational impact of this kind of instability. Look, Congress is again trying to fund the government. They're heading towards continuing resolutions because, I'll go off script again and say it, because Republicans refuse to fund the social service programs. That's really it. So let's let them know that there are children that rely on them. Here's an action. You can contact your member of Congress and your senators and the president. Actually, I think it's just members of Congress and senators. I think the president is not in on this one. Let them know that 1 in 7 children go hungry, and that they need to make sure that all 16 food security programs at the FDA have sufficient funding to keep all children from being hungry. There's a link down in the resource section of the YouTube description box. If you go to that link, you can find phone numbers and emails for your elected reps, or on your cell phone, use ResistBot, and all you have to do is go to your messaging app and send a message to 50409 on your cell phone. The message is sign PTGJZP. That's sign, SIGN, PTGJZP. Here's the message you're going to send. I'm your constituent, and I want you to know that 1 in 7 children in the richest country on earth go hungry. Their health suffers because they're hungry. It jeopardizes their growth and cognitive and behavioral development while increasing their susceptibility to chronic illnesses like asthma, anemia, developmental delays, and mental health disorders. The U.S. Department of Agriculture has 16 programs to make sure people do not go hungry, and yet here we are. Those programs require additional funding. I want you to make sure to bolster those programs to keep those children fed. This includes SNAP and WIC and all the other 14 others. And just to make sure you know what you're doing, in the email you'll send is the link to the USDA site that has the list of all 16 programs, so the legislative analyst can go look at it. I know budget talks are underway, but children can't wait. You have it in your hands to do something that changes lives for the better. Do it. That's what I've got for you for today. Down below, you can like, share, and subscribe. Send me comments, send me research suggestions. Send them here on YouTube or to Healthcare Advocacy 1, all one word, @gmail.com. Thank you.